Hello again, everybody. This is Professor Howard again, and this week we are looking at our discussion board. And it's an interesting fact pattern this week as we have a elderly gentleman, Tom, who's 67 years old, has been with his wife for over 40 years, and we are looking at end-of-life care. As I discussed in our course overview for the week, end-of-life care and death and dying decisions are something we are going to encounter as medical professionals, especially if we work in facilities that care for the elderly. And even in hospitals, we'll have situations where patients will be coming in their final days or even their final moments. And these kind of decisions are going to come into play in our daily practices. There are legal documents out there that address these issues, and that is what you guys are looking for to answer your first question here is what is an advance directive? So look in Chapter 10, guys, and you will find great examples of what advance directives are. Also, we have to understand, too, is how will an advance directive benefit both the patient and the facility and the treating physician and nurses and other professionals who are working on that individual. That is something to think about in question number 2 on our discussion board this week. So look at why do you guys think having an advance directive would both benefit both the patient and those professionals at the facility who are working on that patient. And again, too, look at question number 3. Again, why would this help out Tom, and probably not just Tom and his wife and his family? Why would it be beneficial to have an advance directive in place to address those end-of-life questions? And again, too, think about it this way also. What would be the problems if Tom didn't have an advance directive? What kind of ambiguity, what kind of uncertainty, what kind of unknowns do you think that would leave for Tom's wife? And what kind of pressures and stress would it put on his little wife if he did not have an advance directive? Some of the things to think about here, guys, in this interesting discussion board this week. Again, if you guys have any questions or concerns, please feel free to email me or text me or contact me, and we can discuss this fact pattern. It's an interesting fact pattern this week. And good luck, guys. And remember, initial postings are due by this coming Wednesday, which would be January 10th. And you must have 2 replies to fellow classmates on the board by the end of the day on Sunday, January 14th. So look forward to seeing everybody's discussions, and I will be responding to you guys here in the coming days.